Across Latin America, thousands of women die from breast cancer that could have been caught early, but screening often doesn't reach rural areas. Salva Health's answer is Julieta, a portable AI-powered device that can go anywhere. Maria, let's start with Julieta. What actually happens when a woman gets screened? How does the experience feel from her point of view?
From her point of view, it takes 10 to 12 minutes. We start with consent forms, then we go into gathering specific data from her, social demographics, and also clinical information that we will compute later on in the model to be able to provide the final recommendation. Then what comes after is one of our operators will get with her into a private space. She would remove her top, and then the operator would place 6 electrodes on each of the breasts. And after 3 minutes, by looking at our Julieta app, they would be able to provide the result in real time. What we do when we train these operators is we make sure that they understand how to get those conversations and make sure that they explain that it's not a diagnosis, and that they go through our 3 different results that we provide on the model. The first one is the risk factor, whether it is low, medium, high, or very high, depending on the information that they provided on the questionnaire that I previously mentioned. Then we provide information regarding the breast density, whether it is high or low. This is very crucial depending the patient's age to determine whether they need a mammography or an ultrasound. Depending on that, the exam may vary on its accuracy. And then the third one is impedance, which is a measure that we use to understand the behavior and the pattern of the tissue, in particular for that patient.
You've made it possible for non-clinicians to operate Julieta safely. Why was that design choice so important to the mission?
We were thinking about access. Some of the main issues that we have in Colombia at the moment are related to infrastructure and lack of personnel. And this is not only in Colombia, but it is replicable to different geographies worldwide. So we knew that to be able to get Julieta to the women that need it the most, we had to make it so that anyone could operate it.
At the heart of it is your AI. In simple terms, how does it know when someone might need a follow-up image?
Julieta uses 3 different things in order to be able to identify whether a woman needs to be prioritized or not. One of them is the information coming from the questionnaire that we gather, which classifies women regarding their risk factor. That is used for us to be able to provide our recommendation on whether you need to do screenings more frequently or not. Then we also use breast density. Breast density is important because this causes some extent like the mammogram to be more sensitive or to have less accuracy itself. So we use that information to recommend whether they need a mammogram or an ultrasound. And then afterwards, we're looking at bioimpedance, which is what we use to understand the tissue behavior and patterns.
As you screen more women, that data keeps growing. How does this data flywheel make Julieta smarter and more valuable over time?
There is something that we would be able to achieve, which is the longitudinal data. In essence, we would have the historic data of women over time, which would help us identify any changes that could lead us to prioritize them sooner. But also for the system, I think it could be game-changing in terms of the information that we capture. It could help not only other companies build on top of it, but also the system itself in terms of public policy and how to better not only educate those communities, but also create policies that help them take care of their health better.
You've already earned in vivo approval in Colombia and are pursuing 7 more countries, including the US. What's your strategy for scaling that fast while staying compliant?
One of the most important factors for us, not only in this particular matter, but across the board, is that we have been really lucky in understanding that it is critical for us to partner with the right organizations. So for this particular aspect, we're also partnering with a group that already has experience in the matter. We're partnering with our ATSI group, and what they're helping us do is they're helping us identify which are those countries within the Latin American ecosystem that have similar specifications that what we already obtain in INVIMA, so that we can fast track our entry to those markets by, in a way, reutilizing the documentation that we already created and making sure that we can scale that way.